Hi, welcome to Talk of the Town, and my first guest is Dr. David Nelson from Eye Contact here in Madison. Dr. Nelson, welcome to the program.
Well, thank you for having me.
And as I understand that you're going to be talking about the second annual Dry Eye Awareness Workshop. Can you tell us a little bit about the Dry Eye Awareness Workshop and what it is?
Well, that's correct. We have a day where we try and let everybody know about dry eye and what the problems are. We have a very quick 10-second test that people can sign up for, and we can tell them whether they have dry eye.
Awesome. And tell us a little bit about what is dry eye really, and how common is it?
Well, actually, dry eye is very common. 40% are predicted to have dry eye in the population, and it's a very important part of the visual system. Actually, the tear film is one of the most important parts of seeing clearly. And when it gets disrupted, what happens is people have stingy, burny, watery eyes, and it's a real problem for the patient.
So if my eyes are watering a lot, it could actually be because I have dry eye.
That's very correct, actually, yes. So if you have watery, stingy, burny eyes, it's actually sometimes the symptoms of dry eyes.
Yeah. I'm just curious, do you find that there's more cases of dry eye during the spring when there's all the flowers are in bloom and people are experiencing allergies and so forth?
Well, the tear film is a very complex subject in science, and actually there are inflammatory responses like allergies that are part of dry eye problems as well.
Yeah. Why is this a problem? If somebody has watery eyes, how problematic is that really?
Well, when a person has dry eyes and stinging, burning is the result of cornea nerves that are very tingling, because one of the most important parts of the human system is to maintain vision. And the dome of the cornea, or the cornea, which is the dome of the eye, is that protective surface that needs to be intact so that the eye is clear and sees properly. And when it has a problem, it senses and sends things to the tear film to fight what it thinks is an infection to keep that surface clear.
And do we know what the causes of dry eye are? I mean, do we know what causes people to have that itchy, burny, stingy, watery sensation?
As time goes on, it turns out that the tears become more viscous, and they also have more salt in them. And that is a problem for the cells of the epithelium, which is kind of like the skin that covers the eye. If you think about some sort of like a rug burn or scraping the skin on your hand, it's a little bit like that with the eye. And then every time salt gets into that, it hurts and it stings and it burns, and then it causes that watery eye.
Sure. And when you say as time goes on, you're talking about as people age and get older.
As people age and get older, sometimes things creep in and it becomes more problematic. As well, contact lens wearers sometimes suffer from dry eyes just because of that plastic piece of material that sits on the eye.
Sure. Tell us a little bit about this testing procedure that you mentioned towards the beginning of our segment today, how you test for dry eye.
Well, it's a new instrument that measures the tear osmolarity of the eye, and it can tell us within 10 seconds whether or not a person has dry eyes. And it's painless. It's something that we just touch the surface of the tears. It takes a microliter sample of that sample and then tells us whether or not it has too much viscosity or salt.
And tell us, what does that osmolarity mean again? What does that word mean?
It's a viscous tear film that is containing more salt.
Sure.
And that salt is harmful to the cells of the epithelium, and actually that's what stings and burns.
Okay, gotcha. And what are your procedures for treating dry eye?
Well, we have a number of things that we can do, including punctal plugs. We have medications and pharmaceutical agents that we can put in eyes. We also use tear substitutes and gels at night. We also have found that you can use triglyceride fatty acids or omega-3s that are pills that people take that are natural anti-inflammatory agents.
Yeah, absolutely. And so I'm really curious to find out more about this dry eye awareness workshop. What are some of the events that are going to be going on during the time of the workshop? Can you walk us through the day a little bit?
Well, what we're going to do is have a discussion about dry eyes every half hour.
Okay.
And we'll have about a 10-minute discussion about dry eyes. And then what we'll have people do is sign up for this tear osmolarity test. And it only takes, like I said, about 10 seconds. And then what we'll do is we'll take those people and tell them whether or not they have dry eyes. And then what we can do is schedule an examination and go further if the patient decides they'd like to do something further about their dry eyes.
And how does somebody sign up for the Dry Eye Awareness Workshop?
Well, by calling our office at 608-833-4242 and signing up for the Dry Eye Awareness Workshop.
Awesome. 608-833-4242 is the number?
That's correct.
Awesome. Well, Dr. David Nelson, I want to thank you so much for the information today. I feel like I need to go and get checked for it now. It's like one of those things, the power of suggestion. I kind of feel like my eyes are starting to burn a little bit.
Well, these bright lights in this studio actually would cause that too.
That's true. 2 hours of doing this a day, I suppose. So.
All right. Well, thank you very much.
Nice talking with you. Don't go away. There's more Talk of the Town coming up right after this.